Thank you for joining Cancer Support Community Atlanta for Cancer and Cognition, How Cancer Impacts Your Everyday Life. Facilitated by Nicole Kong with Northside Hospital Rehabilitation Services and moderated by Tanya Duke, also with Northside Hospital Rehabilitation Services. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. If this is your first time participating, we invite you to complete a new attendee form to stay connected to all future programs. Welcome everyone to today's program, Cancer and Cognition, How Cancer Impacts Your Everyday Life. I'm Katie Armsby, the Program Outreach Director with Cancer Support Community Atlanta. If this is your first time participating in a Cancer Support Community Atlanta program, we welcome you and invite you to visit our website, cscatlanta.org, where you can see a complete list of the virtual oncology programs offered. These include virtual support groups led by licensed mental health professionals, stress reduction classes like yoga and Tai Chi, a monthly nutrition seminar facilitated by Oncology dietitian with Northside Hospital Cancer Institute, and education programs like these. And if you ever miss a live event, we invite you to visit the video tab of our website, where you can see recordings of past programs. As a reminder, everyone will remain on mute for the duration of today's program. We invite you to enter questions into the program chat box, which Tanya and Nikki will address at the end of the program, time permitting. So I'm excited to welcome today's program moderator, Tanya Duke. Tanya Duke is the Rehabilitation Supervisor for Speech Pathology at Northside Hospital Atlanta and has been with Northside Hospital since 2013. She's a seasoned speech-language pathologist with over 20 years of experience in the medical setting and is board certified in swallowing and swallowing disorders. Specifically in reference to oncology services, she has extensive experience in evaluation and treatment of voice and swallowing disorders and was awarded the Margaret A. Riley Sharing the Journey Scholarship for Oncology Professionals. So with that, welcome Tanya, and I'm going to go ahead and pass it off to you to begin today's presentation.
Thank you, Katie. Thank you. I am so excited to be the moderator for Nikki, Nicole Kong. She is an amazing therapist. So with that in mind, Nicole Kong is a licensed speech pathologist through the American Speech, Language, and Hearing Association, ASHA. And she has been a speech pathologist here at Northside Hospital since 2019, but she's been a speech pathologist for over 13 years, treating a variety of patients from pediatrics through the elderly population, with the majority of her focus being treatment with adults and geriatrics in both the hospital and the outpatient setting. She specializes in the treatment of speech, language, and swallowing problems that people may experience, such as after a stroke, or if they have a progressive neurologic disease, such as Parkinson's disease or multiple sclerosis, maybe after a head injury, and then definitely cancer. And specifically in relation to oncology, Nicole focuses on the treatment of cognitive and brain function, which we are very excited to talk about today, but then also swallowing function, specifically with the oncology population. Like I said before, she's been here with Northside on the Atlanta campus since October of 2019. And in her spare time, she is running after her adorable one-year-old little boy. And she is an avid UGA football fan. And I think her husband, who is very sweet, is an Auburn fan. So you can imagine the home life. So very pleased and excited to hear Nikki speak today.
Tanya and Katie, thank you so much. I'm very excited to be here this afternoon. How is everyone doing today? I hope everyone's doing well. I'm very, very excited and honored to be presenting regarding cognition and how that affects the cancer population. Throughout my practice, I have worked with many people with a variety of different cognitive needs, and this has been an area that has been very, very interested in the last few, especially since working in outpatient and starting at Northside. So my dream and goal would be to expand our services to oncology, especially with this population here. And so today I'm going to talk to you about what we do as speech pathologists, the things that you might be experiencing regarding cognition, and what you could do about it. All right, so here we go. So again, we're going to be working as to cancer and cognition and how that impacts your everyday life. So a lot of people will describe to me certain characteristics such as, I'm going to the refrigerator and I was going to open the door and grab something, then all of a sudden, poof, it just left my mind. Or I've also had patients that will, say, I had that word and it was just right off the tip of my tongue and poof, it's gone. Other people will say, I was trying to work on something and then there was some noise in the background. It was just way too distracting. It was too hard to focus. How many of you guys out there feel this all the time? I'm pretty sure a lot of you do. And so with that being said, part of that could be a cognitive impairment that you may have experienced during or after cancer treatment. So what we're going to go over today is what exactly is cognitive impairment and those signs and symptoms, and how do we treat and how that impacts your everyday life, especially if you want to go back to work or just, retire or just hang out with your family and friends. Also, too, we're going to answer the question, what do you do if you suspect cognitive challenges? And how do we manage the chemo brain or just the cognitive impairment after or during your treatment? So there is a story. One of the interests of mine that started this project was I was listening to a podcast. And there was a speech pathologist. Her name is Mary Ellen Eller, and she's actually the speech pathologist and the supervisor at the Duke Rehab hospital up in North Carolina. And she is actually a breast cancer survivor. And for someone who treats cognition and language and swallowing, she experienced what our patients go through. So her story actually touched me because it made me feel that this can happen to anybody. Cognitive impairment does not have, it could go and affect anyone. So it's not just anyone in particular. So her story was really fascinating to me. So it ended up happening where I first noticed my chemo brain when I was leading meetings in my small department of 4 speech pathologists. We've been a team for years and communicated well, but in meetings, I experienced difficulty keeping a thought. I get lost in what I was saying and freezing in mid-sentence. I couldn't think of a word, so would use another word as a poor substitute. I also struggled to write patient notes, often sitting for prolonged lengths of time in front of a computer, trying to think of common terms. I knew I was experiencing more than just typical lapses, and I couldn't brush it off as senior moments. I wish I could tell you how I applied a standard treatment plan for chemo brain, and I'm not functionally normal, but a standard treatment plan doesn't exist, and I'm not all better. So with her summary of her experience, this probably touches a lot of you guys out there experiencing those same things. On her podcast, she had mentioned that she would go to the copier and accidentally forget to bring the papers, or she was in a meeting and all of a sudden she could hear what people were saying, but she couldn't remember how to write it down. So things like that happen to a lot of us. And so even though speech pathologists do work on cognition, we have the ability to have some cognitive issues. So again, this could happen to anybody. So exactly what is cognitive impairment? So the majority of the lingo that we hear out there is chemo brain. And so according to the Mayo Clinic, it's the common term used by cancer survivors to describe thinking and memory problems that can occur during and after cancer treatment. Also, too, we may hear it as chemo fog, cancer-related cognitive impairment, or cognitive dysfunction. And it can affect many areas such as concentration, short-term memory, problem solving, and word finding. And the severity can range between very mild to where you may find it just be very subtle to very severe, affecting our ability to engage in everyday activities, and including things like work, cooking, or even budgeting. So what exactly are the common etiologies or reasons to have cancer related cognitive issues? So many factors can contribute to this. So partly can be due to the nature of where the cancer is, such as brain cancer. A lot of it does deal with chemotherapy and radiation, since those are very powerful medicines. Our brain is definitely affected by them. Certain drug treatments, maybe certain drug interactions can happen. Immunotherapy, sometimes surgery in itself. Hormonotherapy, a lot of our hormones do affect our cognitive thinking, so that can play a part. Definitely fatigue, stress, sleep. I mean, it's so hard where sleep, if that is not one of the things that we get, it's hard to recharge our batteries. So for sure, when we're thinking about so much, we definitely have a hard time getting our sleep and recharging that battery. Depression, pain, of course, can play a huge part because that's all we think about. Infections, our ability to, get adequate nutrition if we're not, eating well enough for our bodies to continue to work, our brain will also be affected. And of course, there are other medical conditions or comorbidities that can affect as patients like you guys go through cancer treatment. So, diabetes or other neurological issues, thyroid, things like that. Okay, so what exactly is cognition and what makes it what it is? So it's actually not like one particular skill. Cognition is a large high-level process that utilizes different skills of our brain that just play a part of it. So the major areas that our brain uses for cognition is attention, memory, language, visuospatial skills, and executive functioning. So what we're going to do is, over the next few slides, we're going to talk about each one and how that affects what we do in everyday life and activities. So the first one is attention. So pretty much attention is just maintaining that focus over a period of time with a certain task. And there's different ways we can attend to things. So for example, we can specifically focus on one aspect of our environment, ignoring out other areas in the background. So for example, if we're engaging in something on our computer and then we've got the TV running in the background, sometimes we're able just to focus on our computer, just having that quote unquote background noise and not having that bother us. Others, we can multitask. So this was kind of funny. My husband always loves to joke with me about how I don't multitask very well in nature, but we ended up having Father's Day brunch and he had requested French toast, scrambled eggs and cheese, and sausage. And I cooked all three of those on the burner and I did pretty well with that. And he was actually quite impressed that I was able to multitask. So that would be a classic example of multitasking. Paying attention to processing information is part of attention. So for example, when I was going back to Mary Eller's story and how she said she would listen but not able to process what she heard. So this is where attention can help us see how fast the computation rate is by what we absorb, whether we view it or listen to it, and then we try to organize the information that we process. Certain tasks that are new can increase the attention. For example, if you were to learn a new process at a job, or if there is a new place that you don't know the directions to. Sometimes it may be where you need to pay extra attention to, okay, is it this way or this way? So that way you're not missing out. And sometimes that may feel like it takes longer to learn a new skill or process. But once we do, and the task does become familiar, then we can go into pilot mode or just have automatic attention. So for example, if you do the same driving route every morning, well, that's where, you know, you might be able to zone out and listen to the music. I mean, always pay attention to what you're doing when you drive, but, you know, things like that. Or if you have been able to cook the same recipe for many, many years, and it's just second nature to you, then you can be able to engage with family, you know, when you converse with them. So things like that is what we consider automatic. The next skill that cognition utilizes is memory. And this is, of course, one of those areas that a lot of people report having difficulties, whether you are having issues related to the cancer or just not. Sometimes this can be due to just, as we get a little older, we might forget a little things here and there. But memory is definitely a very common area. A lot of people say, I tend to forget things from time to time. So what exactly is memory? Well, this is the ability to register new information, and then the process of retaining it and learning to store that information. So think of your brain like a filing system. You know, you got a new file, you're trying to process to where exactly you're going to organize that file and put it in a certain folder or part of a filing cabinet to where you're going to keep it there. And if you need it, then you'll know where you can retrieve that within your brain, and it'll store it there as long as it's needed. So memory can be broken down into different types of memory. So working memory or short-term memory is one of those terms that people probably hear very often, and people report the most of having difficulties with. So trying to remember what just happened a few minutes ago versus a few weeks ago. So it can be a certain period of time. It does not have to be long-term memory, not things back in your childhood. This is just pretty much recent information. And then you also have long-term memory. That's where you remember events from a long time ago, such as weddings, proms, birthday parties, vacations, things like that. You also have what we call prospective memory, remembering events for future upcoming. So for example, trying to remember dates to doctor's office visits, or remembering a vacation you will be taking and the process that you'll be taking to get there. We also have what we call verbal or auditory memory, which is remembering information while utilizing words. Visual memory, remembering particular movements when you visually see things. We also have motor memory. That's remembering particular movements. So it's like that phrase, it's like riding a bike. You never forget how your body moves a certain way. Then you have procedural memory. This is where you have remembering, you know, particular steps, which can be anything related to your job, related to what you do at home, in regarding to completing a task. And then what we have is episodic memory. And that is when you do recall an event experience. And this again can be similar to remembering weddings, vacations, events of the past. We also have another skill called language. And this is where we need the skills to communicate. And this is what makes us human. And so we have communication or language broken down into two types of skills. We have expressive language, which is the ability to verbalize or express what you want to say. And then you have what we call receptive or comprehension, which can give us the ability to listen, or if we read something, then we process the information to understand it and compute it. So a lot of people think verbalizing is really the only way to communicate, but when you really think about it, there's so many ways we communicate. And it's not just speaking, gesturing, drawing, writing, or we use a combination of everything. So when I have folks that, you know, may have, and I've been like this myself, where if I don't recall the word, I may utilize the gesture. I might play charades, and hopefully my husband will figure out what I'm trying to get off the tip of my tongue. And a lot of the times he does a pretty good job. So with that, I'll use gesturing. And for other folks that may have more difficulties, like those that had strokes, we call those that difficulty expressing or verbalizing, they may have what they call expressive aphasia. And so if it's very hard for them to verbalize, sometimes writing or drawing is a better form of communication for them. So just in general, language can come in many different forms. Oops. All right. So the next skill that we use for cognition is visuospatial skills. So this is where the brain and the eye speak to each other. So this is where you're able to view, scan, process, and understand what we see and use our senses to compute within our environment. So as we look at certain things, like for example, if you're judging the distance on something and, you know, trying to figure out if you're going to be driving and then figure out when to stop, our eyes and our brain can work together to say, okay, you need to start stopping at this particular moment. So that way you're not going to slam into the person in front of you. Or if you're looking at something from afar and you're really pinpointing out, like, okay, looking at the object, seeing its silhouette, then you could be like, okay, I recognize it is this particular thing. So that's where our eyes and our brain really work together. It's almost like our ears and our brain. Our ears listen, and then we then have the brain compute. The last skill that we use for cognition is what we call executive functioning. And this is what considered to be one of the highest level skills that we use. And it's the ability to plan or sequence or implement and accomplish tasks with flexibility and adaptation to environmental situations. So this is kind of where, like, for example, say you have something that you're planning, but then all of a sudden, hey, plans change. We may have to adjust. This is where executive functioning comes in. And sometimes we have to make decisions on, you know, well, if this is going to affect our plans, then what's going to be plan B, or what's the next best choice or case scenario that we need to do in regards to completing an event or task. So this skill, like I said, being that it's the highest functioning skill we have for cognition, this helps us become productive and helps us complete our tasks independently. So when it comes to cognition and how people have difficulty with any of these areas, how is that going to affect our daily lives? So, and what would you experience? And some of this we have gone over at the beginning, but here are the most common signs and symptoms of a cognitive impairment. A lot of times, yes, short-term memory, forgetting not just where you put your keys, but just forgetting what you did last week. Like, I don't remember, you know, participating in that activity. Having trouble learning a new skill. For example, if you have a new EpiPen, or a new medication for diabetes, and say it's a model that you've never used before, that might be difficult to utilize to prick your finger, to, you know, check your blood sugars. Difficulties with multitasking. So if you were to be like me and try to cook 3 things at once on the burner, it might be difficult to do all of that. So some people may have to take it one task at a time. Decreased attention and concentration. So filtering out noise in the background. That might be way too complex for people to just shut that off. I had a patient that I saw the other day who was filling out his paperwork in the waiting room, and there was some background noise, such as phone calls being made and other patients talking with their loved ones, and he just had a really hard time filtering that out. And he said, I used to be able to do that, but I can't. And so things like that make it more difficult. Disorganization, for example, if you've got your desk and it's got everything laid around and you're like, I'm not sure where to even start, or even just a pile of laundry and you put it on your bed and you notice, oh my gosh, this is so overwhelming. I don't even know where to start. Learning to organize that might be difficult, even though it might be an easy task. So, and that can also include starting and completing a task, as well as maintaining your focus on a task. A lot of patients will say, I know I have to do this. It's just so much. I don't even know where to begin. Or I can only do so much, and then I feel so tired, I have to stop. And then I just don't feel like I want to finish the rest of it. And I hate when that happens. And so also too, feeling that mental fog, like I just feel like blah. That's a lot of reports I hear all the time. I need to take a nap, or I feel like I sleep too much, or it's just after a certain period of time, my brain cannot focus anymore. So those mental fog characteristics are very common. And of course, finding the right word to say. Man, it was right off the tip of my tongue. I just have a hard time retrieving that word. So these signs and symptoms of cognitive impairment are very, very common. And again, the range of severity can be very, very mild to very, very severe. Each person's just going to have differences based on their health and their treatment, and just from their overall experiences, what the severity will be like. So how does cognitive impairment affect our lives? Well, it definitely affects our social roles and responsibilities. If you were, for example, working full time and you were doing a lot of activities at work with projects and stuff, and then all of a sudden you start to feel cognitive impairment affecting your performance, not being able to get things done and forgetting stuff, of course that's going to play a huge part in what you might be able to do and not do. Going out and just doing fun activities, whether it be walking or book clubs, or going to a sporting event, or even just hanging out with friends and family. I know it can be very, very tiring for folks with cognitive impairment, because it takes a lot of energy. Ability to return to work. I know for some of my folks that might be finishing up their treatments and they're starting to get back into their daily lives, they're noticing that a lot of the responsibilities at work might be too much for them. So they do fear that if I don't perform well like I used to before, maybe they may think, oh, will I be treated the same, with the same respect? Is this going to affect my job performance? Can my coworkers rely on me? So I know a lot of those questions do tend to float around a lot of my patients' minds. Your self-esteem and emotions, it really can affect your confidence. But knowing too that you are not alone, it probably feels like you're alone. So again, don't feel like you're alone, because you're not. In relationships, certain caregivers may have to take on more responsibility. So that sometimes that can be affecting the person who is having the cognitive impairment, feel like, oh, I feel like a burden, or please help me. And sometimes it might be hard to ask for help. So definitely roles can change within relationships, give a little, take a little. So how to diagnose cognitive impairment? Well, we definitely want to rule out any conditions and contributing factors related to cognitive impairment. So, for example, are medications being a side effect going to affect your memory, such as maybe pain medications? Are you sleeping well? Are you getting the adequate sleep to recharge that battery? Are you getting adequate nutrition? Our brains thrive on, the good fruits and vegetables and the good healthy fats like omegas from salmon and avocado. Are you eating enough of that? Are you anemic? Do you have low iron? Are hormones playing a factor? So sometimes doctors can do a workup to kind of see what might be contributing to the cognitive impairment. Speech language pathologists like myself can help you by evaluating the areas of your cognition and how that affects your daily activities and work. So what we would normally do is that you would come in for an initial assessment that would include intake, interviewing, seeing what areas that you're noticing difficulties with and how that's affecting your performances within your daily activities. And with that, we would do some testing, look at, based on what you tell us, what areas you may have difficulty with. We can definitely do more of an in-depth analysis by doing the testing, and then results will indicate what kind of treatment you will have as your treatment plan. So we could definitely work on strategies such as compensatory strategies with memory, or helping restore some of those skills by stimulating with activities to get the nerve juices going. So in addition to speech pathologists, we actually have like a whole team approach. So it's not just us, but we have other services that can help with cognitive impairment, such as physical and occupational therapists. All of Rehab, we work with many different folks with many different areas of cognitive impairment, and we always work together to do a whole team approach. And then sometimes too, a psychologist and or a psychiatrist could be on your team. So a lot of emotional or behavioral characteristics may appear with some of the cognitive impairment. And so sometimes it's nice to have behavioral health services be a part of that emotional intervention. And then we also have neuropsychologists that can help do more of an in-depth brain analysis. I actually have a lot of patients who want to return to work, but don't know the extent of like if there are any certain accommodations. A neuropsychologist can definitely be the one that can fully assess you and say, okay, if you need more time based on what we see on the results, this is the recommendations that work can allow you to have, or that they recommend the work environment to make it more supportive for you. So again, treatment of cognitive impairment. So everyone's treatment plan, like Mary Eller said, there's no definitive treatment plan. There's no certain exercises or certain steps. There are strategies and there are activities to stimulate these cognitive skills. But what's so unique about cognition is that it's tailored to the individual self, because we're all different. And so what we do, and depending on the symptoms and how it affects our daily lives, will determine how we create your treatment plan. So certain behavioral or compensatory strategies that we come up with can be general, but we can make it very specific to a certain task, like such as, a certain work process that you want to implement. And like I said, we're also looking at restorative skills. So if there was a skill such as word finding that you have lost, then we work on activities to do, such as confrontational naming. Tell me what this is in a certain amount of seconds. So that stimulates the brain to be like, okay, we're going to try to see what we can do to make it stronger. We call this neuroplasticity, in case anyone has heard of that term. And of course, education plays a huge role, because we're not just treating the individual, we're also treating the caregivers, such as the family, the friends that are a part of the individual support personnel. So this is where certain strategies, if the individual who we're treating may have a hard time implementing a strategy, then we teach the caregivers or the family how to implement the strategies. So that way it is a success for the person who's got this cognitive impairment to feel that they're able to do the tasks that they've been wanting to do. And like I said, treatment is very specific to the individual. So we're talking about strategies. So what are the strategies to help improve cognition? Now, they are very common. And a lot of the times when I do implement or educate these strategies to my patients, they are like, oh yeah, I didn't realize that I was able to do this. So these are general, but what we do is that when we talk to the individual, whether it be during the initial evaluation or during the first few treatments, we get an idea of what is the ultimate goal. What is it that you want to accomplish? This is where the strategies can then be tailored and shaped to help that person succeed and accomplish the task that they're hoping to do based on their goals. So for memory, what are the typical memory strategies? Well, daily planners and calendars. How many of us have a daily planner or use a wall calendar or your phone calendar? There's so many different calendars, which is kind of nice. Some of my patients like writing them down. Some of them like to be technologically savvy and use the Google Calendar or the one from their iPhones. Alarms, that's a big one. What's great is that these new smart watches have alarms that vibrate. You have them on your phone. For example, during my son's first year of life, trying to figure out what time to feed him, what time to put him down, what time to eat, I put alarms on my phone all the time because I got very distracted. And of course, having lack of sleep as being a first-time parent, you're trying to adjust the new life. So this is where I heavily use my iPhone alarms, and I would choose certain sounds that would represent a certain event. So that way it's not the same alarm, because when I first started, I was like, my alarm's going off. There's just too many. But then as I kind of tailored it and refined it, that's where certain alarms I learned will be related to certain things. Now my phone was still annoying because again, it was still going off all the time, but at least I knew what to expect as I learned what sound went with what activity. Notebooks. Some people will write down just a general notebook with a list of things to do for the day or jot down information. Sometimes people use notebooks and then use it as a diary. I've had patients that say, I want to remember certain things like, hanging out with my grandchildren, but I don't remember what we did. This is kind of where a diary can really come into play. And so that is definitely a hit with a lot of my patients. Post-it notes. I mean, I have them all over everywhere. Whoever invented Post-it notes must be rich because it is a great invention. I use it all the time. Like I said, smartwatches, our phones in itself. It's got so many apps that we can use to help us remember things and organize things. Again, making lists, it could be either on an app or writing it down in a notebook. Using a pill box. So a lot of patients will, at the beginning of the week, go over, okay, this is what I'm going to have, and then fill up their pill boxes. So that way they're not missing their dosages. Voice recordings. This is a big one. So again, there are a lot of voice memo apps on our phones that we can just hit that speaker recorder icon, and then it will help us remember stuff by recording our voice versus typing it. Of course, we've got other reminder apps and other things that can help just by using our brain. Sometimes we just need to pay extra attention. So like, for example, if there's something that, catches your eye, you're going to be hyper focused. Like if something caught your attention on the news and then you turn on the volume and you're really focused, or if you're driving and you're really trying to learn where your surroundings are, you're going to really pay extra attention to those things. And other ways utilizing your brain, whether you use a device or not, learning in small chunks can help as well. So instead of remembering, for example, 10 things, chunk it up into 2 or 3 things at a time. For example, our social security numbers and our phone numbers. There's a reason why you've got the area code, the first 3 numbers, and the last 4 digits. It's easier to remember in small groups versus one long line of numbers. Repeat, repeat, repeat. I need book, I need a shoe, I need a jar at the store. Book, jar, shoe, book, jar, shoe. So just repeating it over and over again. Some people will say, like, just to make sure that I didn't miss my appointment, I not only put it in my calendar on my phone, but I also put it in our family calendar, and I have it on the Post-it board on my refrigerator. It's okay to do that multiple times because you'll remember that you wrote it down somewhere frequently. Associating, linking new ideas to the information that you want to remember. So for example, names is a very good example. So if you're trying to remember so-and-so's name, like, oh, you remind me of this person, or you're reminded by a certain characteristic that might represent who they are that is similar to their name. So you can, like, for example, Emily, if she's energetic, energetic Emily. Simple as that. Visual pictures. So some people might be quote unquote better visual learners. So they may be able to look at things a lot better in depth. Mind maps. These are like graphic organizers. So I know back in middle school, we did this when we were trying to organize a paper. Maybe you might have done this in high school or college, where you took a main idea and then you drew lines and then had little bubbles and then filled out the supporting ideas. That's an example of a mind map. Sometimes utilizing arrows, like if you're doing a step-by-step process, first you might do this, then you might draw another arrow. That can be a great example of a mind map in real life, in real world. And then another way we can use our brains to help us remember is what we call first letter cueing. This is where we're like, okay, that thing I wanted to remember, it started with this particular letter. So again, going back to Emily, she was really energetic. Her name started with the letter E. Or if there was an object, oh, what was that I needed at the store? It started with the letter A, apple. So that is a great example of using first letter cueing. So other ways to improve your cognition, and this is also where you can relate it to attention, executive functioning, processing, organizing in everyday activity. So establish a routine and structure. I mean, I don't know how often we've had to revamp our structure at home with our son because he's always changing, but he likes that. He likes structure. That's the same thing with people that are unsure with their cognitive skills at the moment. Sometimes predictability is good because then, having the same routine becomes second nature. And so then that's where you can go into autopilot mode. So structure can be such a great way to help with some of the cognitive deficits. That phrase, a place for everything and everything in its place. So always put your keys in the same spot. I know where people will say, I lost my phone, I can't find it. So for example, designate a place where if you're in a room, especially if it's like the most common rooms, like a bedroom or a living room or the kitchen, place your phone in that same location, in that same room. So again, once you start knowing where your phone is in that room, it becomes second nature. Improve your overall well-being. So it's, I'm sure it's just a stressful time when going through cancer treatment. So this is where you want to try to see if you can find things that relaxes you, whether it is taking a walk or hanging out with, friends and family, staying physically active, engage in activities that make you happy. The brain it thrives on positivity. So find things that bring that positive reinforcement into your life. Eating adequate nutrition, hydrate, get the fruits and vegetables in. And a lot of times too, sometimes taking mental breaks, it's okay. Sometimes people will say, I got to get this done, but then it gets overwhelming. And then you run out of gas, you get really tired. It's okay if you might need to take a little snooze in the middle of the day. Or sometimes taking that extra hour or two of sleep is possibly necessary. Or if you feel like, okay, maybe not so much sleep, then maybe a little walk outside might be enough to give you that break. So that's where, again, whatever makes it feel like you're refreshed and recharged, you utilize that as a mental break. Minimize distractions. So use headphones, earplugs, white noises, turn down everything. I know a common one is, I hear a lot of talking in the background if I'm trying to read something or engage in something and then the TV's on. Turn the TV off. Or if you wanted to listen to music, but then there's words that are within the song, but you still want to listen to music, maybe change the music to something that is more instrumental, like jazz music or classical music versus something with words in it. Work when it's the best time of your day. A lot of people say that if I start doing complex tasks toward the end of the day when I've already gone shopping or, we've been hanging out for so long with friends and then I got to come home and do these things, it's exhausting and I just don't have the energy. This is where you have to possibly just kind of feel out what is the best time of the day for you? When are you the most energetic? When do you feel the most focused? You probably want to do your complex or hardest tasks at that time. So that way you can coast at the end of the day if that works for you. And target one thing at a time. Sometimes multitasking isn't the right thing to do. And I know, we've got so much going on at once, but we may tend to forget things. So it's really good if we can try to focus on one thing at a time. We'll be able to not miss out on certain steps or forget a certain piece of information that we may need to complete a task. Double check your work, don't rush. It's always best to do that. My mom would always say, don't rush your math problems. Always double check your work, especially when you didn't want to be the last person to turn in your quiz. It's okay. Sometimes turning in your quiz last may make it better. Be assertive. It's okay to say no. A lot of us have so many responsibilities on our shoulders, and especially when we have so many people that are willing to help us, sometimes it's hard to give in and say, is it okay if you take this task, or you don't want to hurt people's feelings. So if you're exhausted, but say there's a family party that you would love to go to, but you're just tired, but you don't want to disappoint people, it's okay to say no. In the end, it's all about you and your recovery. And a lot of people will understand. So sometimes it's hard to change that mindset that it's okay to turn down things if you need to, because in the end, it's all about your well-being. And reward yourself. If you know that, oh my gosh, I got this done, even though you may have only taken 15 minutes, but you got 15 minutes of that task done, reward yourself. Take a little walk or take a nice break and, call that special friend or family member of yours. Again, think about positivity for your well-being. So what do you do if you suspect you may have a cognitive impairment? Well, first and foremost, definitely discuss this with your doctor. What we want to do is this whole presentation is to let you guys know that there are options out there. And if you feel like you are one of those that are being affected, your doctor can write a referral for speech pathology, and then we can formally assess you for cognitive treatment. So as we have speech pathology services available in all areas of our Northside system. So that includes Cherokee, Forsyth, Alpharetta, Gwinnett, and here on main campus. So we can provide exercises for both speech and swallowing. We also have treatment to help increase understanding and communicate language. We have voice therapy, cognition. We can do oral motor exercises in case you feel that there are any difficulties with your speech or your swallowing. We address those. We also help with people who may need assistive communication devices. For example, I've had a few patients who've had strokes, and we can use either high-tech or low-tech devices. And a low-tech device could be a simple notebook with words on it and they carry that around with them, or it could be a laptop or a tablet with a touch screen that has all sorts of pictures that has voice output. So it can be very, very tailored to each person based on their needs. We also do what we call vital stem. It's kind of where we put electrodes on the throat to help stimulate the swallow muscles. We do certain swallow instrumentation studies. One of them is called a modified barium swallow study. You've also may heard it as a barium swallow study or an X-ray swallow study or swallow test. What we do is that we do this in radiology. We have radiologists take X-rays while we have patients swallow contrast that will show up, and we look at different consistencies to make sure the swallow muscles are protecting the airway. We also do video stroboscopy for functional voice evaluation. So we'll take a camera and we will look at a person's vocal cords or within their voice box to make sure that their voice is functioning. We also do a specific type of voice therapy called Lee Silverman voice therapy, LSVT. So if patients that also have like neurological disorders or just have really difficulty with their voice production getting louder, this is a specialized program to help them with their vocal quality. We also have another swallow study like instrumentation called fiber optic endoscopy evaluation of the swallow. That's why we call it FEES, F-E-E-S. It's a mouthful, but again, it's very similar to a stroboscopy where we look at your voice box while you swallow to make sure your swallowing muscles are protecting the airway as it goes into the esophagus, to make sure we're not aspirating or getting food or liquid into the lungs. And we just look at that from a different view, which is kind of nice. Pre-treatment evaluation and management of swallowing for patients with head and neck cancer. So if patients who may need radiation during their treatment and their swallowing is going to be affected, we can do swallow exercises to get them ready for their exercise program. So as they start having swallowing difficulties during their treatment, this is where we can try to do what we can to preserve as much as they're swallowing or continue to help strengthen the swallow as they go through treatment. So we do provide more than just being able to speak. We do swallowing, we do cognition. So we do a variety of things. So we're, in a way, we're a speech, language, cognition, and swallowing therapist. So like I said, if you feel like you may need any of our services, we have many different locations in Canton. We have on main campus in Atlanta, our outpatient right off of Meridian Mark across the street from Status Right. We're also expanding our services within the tower. So if you are a current patient in the cancer center at the tower, what's nice is that if you get infusions or if you are seeing your appointments in the tower, you can also receive services there. So one-stop shop. We're also in Alpharetta, we're also in Duluth, Lawrenceville, and Forsyth. We also have services within Sovereign Rehab if you're not close to one of our main campus. And we also do telehealth, which has been kind of nice with COVID. I know that certain patients that might be so tired to be running around and they're fatigued, telehealth can be a really nice alternative. Or if you live far away and it's just really hard to get services, that's another advantage for telehealth. So again, all you need to do is talk to your doctor, say, you know, I think I'm having some issues with my cognition. I would like to get it checked out. Have them write a referral for speech and language evaluation. And based on the location, the doctor can go ahead and fax a referral to us, and we can definitely get you set up for scheduling. So again, the referral process, what we want to make sure is just have your doctor write your name, your phone number, what you want, whether it be, you know, in addition to speech services, maybe you want physical or occupational therapy. We also have audiologists on staff, so they can also check with your hearing and your balance. There are certain diagnostic codes that we may need in order to process the insurance, so we want to make sure those are on there. The physician's signature needs to be on there, and then of course the date and time of when they refer it to us. So like I said, we have schedulers all over our campuses that will reach out to you and say that, hey, we've received a referral, what time would you like to come in? And then based on your availability, we'll be able to schedule. So most of the time, once we get the referral, it give us about a business day or two and before we get a chance to reach out to you. And if you need any further information, below here are our websites, or you can just Google Northside Outpatient Rehab Services, and then you can get the links there. And also to Sovereign Rehab as well. So, any questions that you guys have in regards to this presentation today?
We have some good questions, Nikki, that have come in.
All right.
So we've only got a few minutes, so I'm going to try to speak to some that were asked that maybe you haven't answered already.
Okay.
One question that intrigued me was someone who said, I completed treatment about 6 months ago, but I'm still experiencing chemo brain. Is it too late for me to come in for therapy?
No. If you still feel like, hey, I'm still not back to myself, the great thing about it is that a lot of the times when people have chemo brain, and then once they finish treatment, sometimes just depending on time, a lot of the cognitive impairment can resolve. But if it doesn't, or if you're in the middle of trying to recuperate, it's not too late at all. Definitely talk to your doctor, get a referral. We would love to see you. So yes, even if it's several years post out, definitely we can see you.
That's right. That's right. Are there any medications or anything I can do proactively to reduce my chance of developing cognitive changes as I start treatment?
So this is where, in a nutshell, it would be, you would have to discuss that with your doctor. There are multiple factors that would play a part on whether or not medication to help for cognition would be needed. First and foremost, it depends on where you are in your treatment. Are you going through it right now, or are you post-op? There might be certain medications that may not be appropriate to take based on the treatment that you're going through, maybe certain side effects or drug interactions for those who might be a few months to several years post-op. You know, again, depending on too, you know, nutrition, sleep, lifestyle. Your doctor might look at those first before, you know, looking at medication. So again, it's really going to determine based on your own individual self, but talk closely with your doctor if medication is something that you are interested in.
Thank you, Nikki. Thank you. I think we have ran out of time today, but if anybody has any questions about seeing a speech pathologist, has questions about their memory, cognition, and wants help, we have a very large team system-wide. Nikki is here on the Atlanta campus. We have several here on the Atlanta campus, but also, like Nikki said, every Northside hospital has a speech pathologist who can help you. So whatever is convenient for you. So please don't hesitate to talk to your doctor and ask for a referral.
Thank you both, Tanya and Nikki, so much today. A lot of great information and tips and tools. If anybody knows someone who wasn't able to attend today's event, you can probably find a recording of it. I'm thinking next week on our website, and that's again cscatlanta.org. Under that video tab, you can find a recording of today's event. So thank you both so much for being with us here today. And I did put that Northside Oncology Rehab Services website in the chat box. So if anybody would like additional information, they can find that there. Thank you, everybody, for your time, and we hope to see you soon. Take care.
Thank you.
Thank you, everybody. Take care.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.